Wednesday, and that means it's time for us to delve into medical matters. Our resident GP is Dr. Vicky Skitter.
The treatment for depression, there's sort of many modalities. So obviously, we think of psychotherapy. I think we all need a bit of psychotherapy at some stage. The founder, this is a little bit of history again. The founder of psychoanalysis was actually an Austrian neurologist, Sigmund Freud. He was around in the late 1800s, early 1900s, and he described psychotherapy or psychoanalysis as a clinical method of evaluating and treating pathologies in the psyche through dialogue between a patient and a psychoanalyst. So it's an old thing, we all know about that. You can get family therapy, you can get couples therapy, and it teaches you self-help strategies. So that's very, very important. Obviously, you get medication. Some people has to be hospitalized. And then I want to just chat quickly about the ECT, electroconvulsive shock therapy. So there was this movie made with Jack Nicholson in 1975, I'll still remember that very well, One Flew Over the Cuckoo's Nest, where he was in a mental institution and they actually shot a scene where he got ECT. He was like biting down on something and his face was contorting. It's horrific. And it's very important to know that that's really not what happens. So actually, it is one of the safest and the most effective treatment for resistant depression or those suicidal patients. There's a misconception. So it's not like your depression gets painfully shocked out of your system. I mean, it's not like that at all. The electrodes is placed on your scalp and finely controlled electric currents are applied while you're under general anesthesia. So you're asleep. You don't know about this. There's no pain. It causes a brief seizure in the brain, and it's one of the fastest ways of treating severely resistant depression, or when the patient poses a severe threat to themselves or to others, and there's no time to wait for medicine to kick in. That's when we think of that. Interesting newer version of that is called TMS, transcranial magnetic stimulation. So this is a much smaller electric current in specific parts of the brain. So there's no seizure or loss of consciousness. You don't need general anesthesia or sedation. It's administered on an outpatient basis. So it's 4 to 5 times a week for 4 to 6 weeks. However, this is very expensive. It's about 30,000 Rand, and medical aids don't cover that yet. But it's quite exciting to know that we don't all have to bite down on sticks and be like Jack Nicholson. Anyway, then there's a ketamine infusion. Now, ketamine was used as an anesthetic drug on the battlefields in Vietnam in 1970, and the doctors realized then that it has a powerful effect against depression and suicidal thoughts. So you would have 6 doses, of which you get 3 a week. The side effects can be loss of consciousness or drop in blood pressure. So you need careful observation in a specialized medical setting. So that's that. Then obviously the medication or pharmacotherapy, there's more than 20 antidepressants available in South Africa. It's very important to know that lots of those medicines are actually safe during pregnancy and breastfeeding. Most people think they have to stop their medication when they want to start a family, and then things go awry. So it's very important that you chat to your doctor first. Don't just stop your medicine and then think, okay, now I'm going to fall pregnant and everything's going to be fine. We really have to think about that carefully, to chat to your doctor and first see what your options are. So in conclusion, I hope I've convinced you that depression is actually a disease and not just a mental illness. It's a serious disease, and it can result in significant disability and death. There are causes, there are symptoms, there are treatments. And I always say a healthy mind is the first step towards a healthy body. Thank you for listening. I hope you found this informative, and we'll see you next week.